Good afternoon. My name is Nicholas Ostrem, and from my experiential learning, I'm working as a contact tracer for Johnson County Public Health. My supervisor is Samuel Jarvis, Community Health Manager at Johnson County Public Health. My job as a contact tracer involves speaking with people who have tested positive for COVID-19, determining who they were in contact with during the period of time where they were infectious, and then calling up those people who they were in contact with and informing them of our quarantine recommendations, as well as what to do if they start to get sick. In this last month, Johnson County is experiencing record number of cases of COVID-19, and so our job is to limit the spread as much as we can by encouraging those who are potentially contagious to stay home. This experience has really put my people skills to the test. Ever since I've entered the workforce, I've taken positions where communication is a major part of what I do, from my first job working for the U.S. Census, to my various positions in theater, to my various customer service jobs. And while this job moves that communication from in-person to over the phone, there's a lot of crossover in what I do day to day. I need to be fully informed and be able to correct somebody if they have wrong information. I need to be empathetic and listen to people when they have something to say about their experience with the disease. And most importantly, I have to come across as an authority, someone who's doing a necessary job, because if you don't come across like that, people are less likely to tell you what you need. You need to do all of these things in order to gain their trust, because that will make what you need easier to get. The other side of this emphasis on communication is that I have to be in constant communication with those who are working alongside me. When I'm working, I'm always in a room with 4 or 5 other people to bounce ideas and questions off of, and my supervisors are always just a quick message away if we can't figure it out on our own. But I've also had to develop written communication skills that I've definitely not honed as much in my past. I've always been a really bad note taker because I'm generally confident in my ability to remember things for myself, but in this job I have to take notes for other people, and that means that I have to develop a sense of what needs to be conveyed for someone who I have not said a word to finish this job that I've started. And this has meant a lot of trial and error and a lot of listening to others to see where I need to improve, but I have seen a lot of improvement over the months that I've been doing this job. I've also had to do quite a lot of problem solving on the job. While the order of operations for each case is fairly unchanging, there's a lot of things within those cases that can pop up to make things harder. Many cases that I've worked on have had uncommon or even unique challenges, whether that's getting in contact with an employer, asking about complications from other health issues, or communicating with school officials, or basketball coaches, or exercise class teachers. I've had to develop a keen sense of knowing just what to ask in order to get the information that I need, which in turn prevents me from just sitting there wondering what I do next. These skills, along with others that I've had to develop, like information dissemination and investigation, will stick with me through whatever I want to do next. When I first came to the University of Iowa, I had a very limited understanding of what a public health career looked like. And this experience, more than anything else I've done here at the university, has really helped to develop an understanding of what a job in local public health looks like. It is an experience that will definitely widen my scope of potential jobs after graduation. For now, though, the job is most certainly not done. The pandemic will likely be reaching a new peak within the next few months, and the need for contact tracing will only increase with the number of cases. And so I'm going to continue to work for the county as long as necessary. Hopefully, that will be sooner rather than later, but I will do the job as long as the job needs to be done.